Thank you for taking the time to review my poster. This project began after identifying a significant gap in the literature regarding professional development programs for advanced practice providers, or APPs. While similar programs had been described for nurses, pharmacists, and physicians, there was very limited published evidence specific to APPs. At the same time, our organization was experiencing declining APP engagement. Existing research demonstrated that professional development programs could improve engagement, retention, and professional satisfaction in other healthcare professions, suggesting a potential opportunity for improvement within the APP workforce. In 2017, the Institute for Healthcare Improvement extended the triple aim to the quadruple aim by emphasizing the importance of provider well-being. In addition to improving patient outcomes, reducing healthcare costs, and enhancing the patient experience, healthcare organizations must also focus on supporting and engaging providers. Professional development programs align closely with this goal by recognizing and rewarding individuals who exceed standard job expectations through additional leadership, educational, scholarly, and clinical contributions. My hypothesis was that development of a structured APP professional development program, or PDP, would improve APP engagement at our organization. The original research question was, what are the essential elements of an advanced practice provider professional development program? To answer this question, we conducted two focus groups in August and September of 2019. 12 APPs participated from an eligible population of 178. Most participants were early career APPs with 5 or fewer years of experience. A qualitative inductive analysis was used to identify themes. Participants identified 4 major domains of professional development: clinical excellence, education and scholarship, leadership, and community stewardship. Within these domains, frequently cited examples included research and publication, advanced degrees and certifications, teaching activities, student preceptorship, mentoring, and clinical productivity. Additional themes included patient satisfaction, documentation and billing excellence, continuing education, committee participation, leadership roles, professional membership, public speaking, clinical pathway compliance, networking, and community outreach activities. Participants also identified several challenges to professional engagement, including lack of administrative time, limited physician and leadership support, difficulty balancing professional development with work-life demands, attribution of accomplishments to supervising physicians rather than APPs, and limited recognition of non-billable but highly valuable work such as triage and care coordination. Like most qualitative studies, there were limitations. These included a small sample size, potential selection bias toward highly engaged individuals, and the possibility of facilitator bias, since a researcher also conducted the focus groups. Importantly, participants consistently identified 2 preferred incentives for participation: time and compensation. Overall, the focus groups validated both the need for and the interest in an APP-specific professional development program. In partnership with our human resources and compensation teams, we launched an APP professional development program in 2024. The final program included 3 tracks: clinical excellence, education, and leadership. Community stewardship was not retained as a separate track, but was embedded within the other tracks. Each track included 2 achievement levels that recognize increasing contributions and professional growth. Since implementation, participation has steadily increased. As shown in Figure 3, total awards increased from 4 in 2024 to 11 in 2025 and 13 in 2026. The clinical excellence track demonstrated the greatest growth. We also observed a substantial increase in Level 2 awards, suggesting that APPs are not only participating, but progressing to higher levels of achievement. Despite this success, several barriers remain. Applicants have identified inadequate remuneration, limited protected time for committees and projects, a burdensome application process, and a once yearly application cycle. To address these challenges, we incorporated PDP discussions into our mentorship program, annual evaluations. We partnered with colleagues across disciplines and increased educational offerings related to research, quality improvement, publication, and scholarship. We now highlight the projects completed for the professional development program during APP week. Turning to outcomes, Figure 1 demonstrates APP engagement trends over time. Engagement scores declined from 3.97 in 2018 to 3.5 in 2023. Following implementation of the PDP, scores stabilized at 3.53, representing an encouraging change after years of decline. Figure 2 highlights turnover trends. Turnover improved from 16% in 2022 to 9% in 2023 and 5% in 2024. Although turnover increased to 13% in 2025, the increase was primarily driven by internal transfers rather than employee separation, suggesting organizational movement rather than workforce loss. In addition to these quantitative measures, we observed increased participation in committees, educational activities, and institutional initiatives. In conclusion, implementation of a structured APP professional development program was associated with increased participation, professional advancement, stabilization of engagement scores, and improved turnover outcomes. These findings support the value of investing in APP professional development and provide a scalable framework that other organizations can adopt to improve workforce engagement, retention, and professional growth. Moving forward, we update the APP professional development program and evaluation rubric annually to support the needs of APPs and the strategic objectives of our center. We continue to work toward non-patient facing time for all APPs. We also have partnered with physicians and other healthcare professionals to maximize support and resources. Providing mentorship during the application process has also helped grow the program. We have prioritized professional development through oncology certification and are supporting success through monthly review courses. Thank you for reviewing my project. I hope to see you during the poster session on Friday. Feel free to reach out with any questions or comments.